I want to say good afternoon and welcome everyone to today's Dissemination Research and Implementation Science Seminar. I'm Heidi Brown, one of the core faculty member on the D&I Launchpad and also an associate professor in the Department of OBGYN. DRISS is our interactive monthly lunchtime virtual seminar to learn about the growing science of dissemination and implementation. We're so happy you're here today, and we hope that you continue to join us for future sessions. I will put some links in the chat for where you can join our mailing list. And at the end, we will also be inviting you to evaluate the seminar. This is a new seminar we started in August, and so we're really looking for feedback and how we can continue to improve this monthly seminar. Today, it is my great pleasure to introduce Dr. Funmi Abraham. Her talk title is Implementing a Youth Advisory Board to Inform Adolescent Health and Medication Safety Research. She's an associate professor in our School of Pharmacy and directs the Collaborative Research on Medication Use for Family Health, CROME Lab. Dr. Abraham's research goal is to improve medication use for vulnerable and underserved populations, particularly adolescents, emerging young adults, and people living with serious chronic health conditions. Her research focuses on development and dissemination of innovative interventions, such as games to promote medication safety and adherence. Dr. Abraham uses human factors and system engineering concepts and techniques to characterize pharmacy practice and medication use processes. And her research foci include opioid medication safety, medication self-management in cystic fibrosis, cancer awareness, and game-based learning. And Dr. Abraham is happy to entertain questions during her presentation today. So if you have a question, you can either unmute and go ahead and interrupt, or you can place it in the chat and I will interrupt Dr. Abraham so that we can make this more of a conversation than a didactic presentation. Thank you so much for being here. And Dr. Abraham, please take it away.
Awesome. Thank you so much, Heidi, for that fantastic introduction. Apologies, everyone. Good afternoon. I sound terrible. I have a cold. So again, if you need me to repeat anything that's not coming across clear, please let me know. But I'm super excited to be with you all today. Thank you all for joining my presentation. And as Heidi said, I would really love this to be more conversational. My goal for this seminar is to really share about my recent experiences within the last 2 years working on developing and implementing a youth advisory board to inform some of the work that I do focused on improving adolescent health and medication safety. So please interrupt, put something in the chat. Happy to take comments and questions as I go along. One of the things I wanted to say, if this topic is super interesting to you, we have published a paper about this in the Research and Social Administrative Pharmacy Journal. I'm happy to share a link to the paper if you like more nitty-gritty details that I might not cover during the presentation. Just wanted to check, you could all see my slides, correct?
Yes, Funmi, we can see him. Thank you.
Fantastic. Okay, so just to provide some background for people that may or may not do work in the youth space, we know that adolescents aged 12 to 17 constitute about 34% of the US population that's under the age of 18. And one of the reasons we considered developing a youth advisory board is that often at times we know that community-based participatory research or community engagement can be really important for thinking about how we design impactful interventions or tailor these interventions for dissemination, implementation, and sustainment. But often at times youth perceive that their voices are not solicited, and this can affect the uptake and sustainment of these interventions. One of the things I've seen over time in my own work is that really having youth perspectives earlier on in the research process can really be helpful in identifying topics that are of interest to them, in having them contribute to the research design and how we interpret some of our research findings. And for me, it's really fun to engage with youth in our work because I'm always blown away when we have their voice represented in research. And just for me, and you kind of see this later on in the presentation, it's really helps to grow their interest in the science, in the health sciences, and in research in general. The other thing that I've seen interacting with youth in this space is it makes research real and visible, and it gives them an opportunity to personally connect with researchers and faculty, and really gives them that personal and human aspects to learning about science. So this has really been really helpful for me, and also for a lot of youth. So we decided to create the Youth Advisory Board because we recognized, as part of our mission to develop and implement novel methods to improve medication safety, health behaviors, and outcomes for youth, that this was kind of a way for us to put that mission into action. Some of the goals of our lab are to make sure that our work is community engaged, is collaborative, we're learning from different disciplines, not just pharmacy, and also thinking about creative ways to improve medication use and health outcomes through education, prevention, and intervention. So currently, we have 2 advisory boards. We have our Youth Advisory Board, which I'm going to be talking about today. We also, within the last year, developed our Pharmacist Advisory Board. And this provides, like I said, examples of ways in which we're putting our mission into action. If people are interested in hearing about the Pharmacist Advisory Board, I'm kind of happy to share our experience in doing that. But for us, we found it very helpful to start with the Youth Advisory Board, run that for some time before starting our Pharmacist Advisory Board, because this takes up a lot of time and effort from our research team to do it well. So for our Youth Advisory Board, when we started, we had 3 main goals in mind as we were thinking about designing our Youth Advisory Board. One, we really wanted to the best of our ability, have a diverse group of youth, not just focused in the Wisconsin area, because some of our work, we also do some work nationally with adolescents. So to the best of our ability, we wanted to kind of expand the inclusion of youths to outside of Wisconsin and different parts of the US. Also, a second main goal for us, it was really to invest in the long-term professional development and mentorship of youth, and really provide opportunities for youth to be exposed to health services and pharmacy and other healthcare fields early in their life. So those were kind of the 3 main goals that we had at the back of our mind, and kind of have influenced how we've structured our labs and the kinds of activities that our youth participate in. So our basic structure, when we meet 4 times a year. We strive to meet 4 times a year, every 3 months. We typically meet virtually. We always meet virtually because we have teens in different time zones in different parts of the country. We typically will meet for about 60 minutes to 90 minutes, and typically we'll have 2 to 3 facilitators, me, myself as the principal investigator, 1 or 2 of our research specialists joining in. And from time to time, we'll have guest speakers, depending on topics that our youth members have said they're interested in learning, either healthcare professionals, pharmacists, non-pharmacists, graduate students, and PharmD students, so student pharmacists. So we've had a variety of speakers over time. In thinking about recruitment and selection, I think this was one of the tough parts for us earlier on in developing our Youth Advisory Board. One of the things we first did was to sit in and observe and learn from an existing Youth Advisory Board that had been around for a while here at UW in the School of Medicine. The social media and adolescent health research team really taught us a lot about how to think about doing this and things we might encounter, and a lot of what to think about. So we modeled a lot of what we did from learning from an existing and well-functioning Youth Advisory Board. So in thinking about recruitment, we started with a lot of email listservs, for example, using Patch, the Provider and Teens Communicating for Health, which is a youth focused organization that we partner with some of our work. They're located around Wisconsin. They have 5 sites in different regions of Wisconsin. We used other listservs through the pharmacy school and other national listservs to recruit. So once youth were recruited, We often will ask for a resume or a CV and specific questions for them to apply. And then we schedule an interview with a research team member, 1 or 2 research team members. And I'll kind of share what that looks like. So in recruitment, I just wanted to kind of share an example flyer of what we put out and to use for recruitment, where we talk about their eligibility, what commitments will look like, and what participants may receive through participation. So once a youth member applies, the applications often will ask about why they're interested in the Youth Advisory Board. We ask for parental consent and a resume, and ask them to kind of think about what their career educational goals are, strengths and opportunities for growth, and why they think their skills or background makes them a suitable candidate for the YAB. We then follow up with the interview, where typically we ask them to tell us about themselves, any volunteer activities they've had, things they enjoy, hobbies or previous jobs they've had, especially for the older youth. And then we ask them to, again, talk to us about why they think they're a great candidate for the YAB. And some of them sometimes have had previous research experience that they want to build on, or are looking for a different type of research experience. And then we also ask them to tell us what they hope to get out of the lab. And so usually 1 or 2 members of our research team will sit in on the interview. So our first cohort, we ended up with 15 youth members. As you can see here on this table, only 14 members share their demographic information, hence the discrepancy. So I'm only sharing characteristics of 14 of our youth members. In this first year, we had mostly female participants. About 70% of the youth members were female. We had a mix of middle school and high school age, which has changed in our current cohort, and you see that. And we had a variety of youth from different race and ethnic backgrounds. We had mostly high school, and then we had teens from the Midwest, the Southeast, Southwest, and also the Western region. This year, though, that has changed quite a bit. We still have a lot of our youth members. We have 16 youth members spread across different parts of the US again. They're mostly female. So that's something we've kind of struggled with, mostly high school, and pretty much mostly high school age. And again, spread across different parts of the US. This year, only 13 members kind of reported, but we have 16 in total. I'm going to pause. I think I see something in the chat.
Thank you. Ozma,
sorry.
do you want to unmute yourself so you can elevate your question, or would you like me to read it?
I'm happy to read it out too.
Yeah. Hi. Thank you for the presentation. Can you hear me?
Yes, we can hear you.
Yeah. So I had a question about using the listserv for recruitment. Does that mean that you have to provide any compensation for accessing these listservs, or is it dependent on the institutions that you use? And in terms of approaching communities and even in general, like you would need to really build trust before approaching them, right? And so would this also be kind of an important factor to get into that before like approaching them for recruitment and asking for their help?
Yes, no, you're correct. So when we started off, we used listservs that were free. So far we haven't paid to use the listservs that we've used. We've typically used free listservs. The other thing we typically do is we also ask them to invite other teens that they think might be interested. So kind of like a snowball approach, where and we've seen that has happened with teens, members that we've had from the prior cohort and this cohort, is when we ask how they heard about the YAB, they'll tell us a teen at my school, blah, 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 told me about it, had a great experience. But I agree with you, especially because as Dr. Mahoney is pointing out, where we've struggled we have a lot of female representation. I think thinking more critically how we can get more male youth to be involved. I think one of the ways we've thought about is, again, going back to we have a really good relationship with Patch. And I've noticed, because we do presentations to their youth groups, to think about how we could strategically try to engage more male youth, if it means maybe finding listservs that we have to pay for. Does that answer your question?
Yes, it does.
Asma? Okay. And Dr. Mahoney's question is, how do you think you can engage more male youth? Is there maybe a different way to get their input? Yes. So Dr. Mahoney, so far what we've done is we work closely with Patch. That's the providers and teens communicating about health group, and they have pretty good male representations across the 5 regions. So about 1 or 2 weeks ago, we presented our vaccine confidence project to them. So that's what we've done so far, is trying to present to their groups, because they have good representation of male voices. They still have quite a bit of females, but they have a good size of youth. We're traveling to Milwaukee also in 2 weeks, I think, to present to one of their Milwaukee groups. So that's kind of how we've been trying to get more male input. Does that answer your question, Dr. Mahoney? That's a really good question.
Yeah, that's kind of what I was thinking about it. That idea of you have to go to where they are and what where they want to be. I'm just thinking with, where are the spaces that you would find male youth, and it sounds like you're doing just that. Makes sense.
Yeah, we're doing that so we're fortunate that with Patch, they have ongoing youth groups that are really great, really engaged. Some of them we can do virtually, but some of them we're not able to, like the Milwaukee group is not very set up for virtual, so they just let us know, and then we go and do in person. It's a really good question. Okay, please feel free to put a note in the chat. Happy to comment. So one of the things I wanted to talk about that we find that's really important with working with youth members is just kind of having clear expectations of what involvement looks like. I've found that this really provides a good structure, so they know what's expected. They know what's expected of interacting with one another, with interacting with the team. So we have about 3 basic categories of expectations around attendance. So we typically talk to them about trying to attend at least 3 of the 4 meetings. And we talked to them about earlier on in the beginning of the year what participation might entail, what it looks like. So again, we talk about they might be involved in helping review materials before group meetings, or prepare things that they might present. We encourage them to participate in group discussion, or that they might provide feedback on some of our ongoing projects, or participate if that's something they choose. So one thing I'll say is, in the first year when we were developing this, we didn't set up the participation to have them directly participating on a project. But as we asked for feedback on what to improve in our subsequent year, that kind of came out where they said, we kind of want to be very actively participating on research. In the first year, we were a little nervous that might be too much of an ask, because we were learning a lot about how to structure it, what teams will want. But we've seen that that's something that's super important to some of our youth members. So we kind of give them the option to do both, depending on how much they want to actively participate in an ongoing research project. Another third expectation we talk about that I think is really important is confidentiality. So doing the best that we can to create and instill a safe space. One of the things we do earlier on is introduce them to human subjects research and the ethics of that, talking about how some of the things we're sharing with them is unpublished findings or ongoing work. and also being sensitive to what's shared by other members. So if a member shares about their health or about a life experience, and kind of helping them understand that what shared stays within the group. In terms of meeting structure, we try to have a consistent meeting structure and a consistent agenda. So that helps them know what to expect, know how to prepare. So typically we meet, they're only committing to a 1-year period, so attending 4 meetings in that 1-year period. And typically, for each meeting, we might have an icebreaker or introductions if we have a guest speakers, and general check-ins from the prior meeting. And this agenda is shared with the youth ahead of time, and we invite them to include if there's something they would like us to talk about. We invite them to include that. What we found with youth that's pretty interesting compared to now that we have a pharmacist advisory board is they don't like having the meeting scheduled way in advance. They like only getting the meeting invites and fixing a date about two weeks or 3 weeks before, because their schedule is always changing. I find with our pharmacist advisory board, they absolutely hate that. They kind of want to know in advance, so they kind of plan and have it on their schedule and make time to do that. So that has been kind of very interesting for us to juggle and tailor depending on the needs of each advisory board. In terms of topics that we cover, often at times for the professional development aspect of the meeting, we typically bring some ideas to the table. We also ask the youth members to also suggest key professional development activities that might be important to them. So some of the things might be doing like a CV workshop or career talks, or learning about a certain health career. And you kind of see that come out later in some of the feedback we've heard from the youth. And so sometimes we also are bringing ideas that we have from our team. So I wanted to share some examples of some youth activities that we've had YAB members participate in. Some of the things that we've had them work on is we've given them opportunity to learn about some of our ongoing research projects. This past year, we focused a lot on our vaping awareness project, and the youth really enjoy that because that's something they kind of see in their communities. We've had them provide feedback on some of our study materials for data collection. We've also had them, our lab is also working on a vaccine confidence outreach project that we partnered with the American Association College of Pharmacists. So those are kind of the 2 projects that we've been focusing on this past year. So I'll kind of provide some basics. So with the vaccine prevention and education project, the youth members really were excited to develop infographics that were tailored to educating teens about vaping and health consequences around vaping. And also one of the things they talked to us about is the kind of information that you provide to parents would look very different. So they kind of wanted to create infographics that were tailored towards teens and tailored towards parents, and then kind of learn from one another. And so we facilitated that through one of our YAB meetings, where each member was able to present and learn and kind of see what one YAB member focused on versus another YAB member, and then talk about what they liked, what could be improved, and why they included the information about vaping that they did. So that's one that they've been working on and really enjoyed. As a follow-up to that, what came out of that is they also wanted to create a similar thing for talking about the environmental impacts on vaping. So we're seeing that they're kind of really passionate about this vaping topic. And a lot of times that's important for us to kind of take the meetings where they want it to go in a way that's helpful to them. Another project that we've talked about and worked on this year is the Vaccine Confident Project. We first introduced the project to them and shared resources that we're using through the American Pharmacists Association so they could learn about that. And then we asked them for their thoughts about this project and the topic, and how they might want to disseminate that information. So this was very interesting to me. Some YAB members wanted to write an article, and one actually did and posted it on social media and has been sharing their reviews and people that have been reading that. So that was quite interesting. Oops, sorry. Another YAB member, some YAB members wanted to kind of present at their schools, maybe to their student groups, and other YAB members were thinking about opportunities to kind of share information on social media. So that the social media dissemination piece often comes up a lot when we talk about dissemination. So sorry, I muted. So I wanted to share a little bit about some of the benefits that the first cohort shared with us of how participation helped them. And I have some verbatim quotes on here, but I wouldn't read all of them verbatim, but I thought it was kind of helpful to learn from them why they participated, what they got out of it, and how it's helped them. So as you can see from one of our participants, something they really enjoy is the opportunity to meet other students from other schools, to learn about their experiences and perspectives. And so they really enjoy kind of connecting with other people in different parts of the region of the US and kind of comparing what their experiences are. Other things that some YAB members have mentioned is really for those that are very interested in pursuing a career in medicine or research or the health sciences, kind of getting that earlier on exposure to different career paths. And we try to have different speakers speak about different career paths. If that's pharmacy, often comes up, and then the other piece that has come up is also developing leadership and teamwork skills, and also thinking about careers in the sciences. YAB members have talked about also gaining knowledge in research and speaking with other adults that are in fields that they're thinking about, and how they could use that to set up their LinkedIn account. Some other comments that we've heard from YAB members is also just meeting other YAB members, meeting other mentors, meeting current pharmacy students in our lab. So one thing that I wanted to emphasize is the structure of our lab is such that we have a lot of student pharmacists that participate and also are looking for opportunities to interact with youth. So we try to facilitate that interaction. Also, some YAB members have mentioned how it also gives them a futuristic view of what they might expect and opportunities to ask questions of what it's like to be in some of these fields as they try to narrow down their decisions on what they might want to focus on in college in the future. And again, as you see with the last participants, again, the opportunity to ask questions, learn from other people, and learn perspectives that they might otherwise not have on their own. So those are some of the benefits that YAB members have reported that are of participating in the YAB. We also have asked about just their general learning experiences, trying to help us understand if the topics we're covering are helping them learn the things they want to learn. So I kind of highlight that here from some of these verbatim quotes is we could see that they're learning about the research processes, which is something we want them to learn. They're learning about how to work with other people from different backgrounds with different interests, learning about how to collaborate with the team. So a lot of times when they're working on aspects of like they're developing their infographic, we'll work with them, or writing that article that they might want to post about a certain topic. They're also learning about pharmacy and different career paths, which we want. We talk often at times, we bring findings about our misuse of medications and what they're seeing in their communities. So we also talk about that, and they're learning that. And also just different perspectives from not just adolescents, but also adults that are within our group, and technology use and what it takes to become a pharmacy or do research as an undergraduate. So sometimes we expose them to current undergraduate students that are working in our lab and some of the research that they're working on. Another aspect that they've talked about learning is advances in the medical field and what college is like. So on our end, as the CROME Lab team, some of the things we've seen by having our youth advisory board is really in helping us do a better job tailoring some of our recruitment materials or research procedures and protocols or interventions to better target youth. Often at times it gives our lab members opportunities to practice speaking with adolescents and learn how to communicate and do a better job communicating with them, improving data collection materials and giving us new perspectives or new ideas about important medication use and adolescent health research. So it's been really a symbiotic relationship. Again, it's not all been rosy. There are different challenges we faced in the first year and continue to try to tackle. One, we're completely virtual, given that we have youth from different time zones. So one of the biggest things we struggle with is scheduling. Scheduling is very difficult. We have to have a lot of meetings on weekends or late nights to kind of accommodate people in the Western time zone, the East and the Midwest. So sometimes it's really hard getting the whole cohort together at the same time. And again, with virtual communication, it's not the same as being in person. So there are pros and cons to that. Also, again, like I mentioned when I shared the characteristics of our youth, is really thinking about how to have more diversity of youth that participate. Some of the things I've also noticed is with having different research specialists participate in the first year, I felt like the youth didn't connect as well whenever we had a different research specialist at a meeting. So this year, one of the things we changed was to have one specific research specialist always communicating with the youth. So they build that relationship, they feel comfortable with them, and we're not having as much handoffs with when new people come on board. But that we've been able to address with this year's cohort. Sorry, I mute myself if I have to cough, so you don't have to hear that. So some future goals for our and direction that we've been thinking about as a group is really to think about how we can provide more individual mentorship to this youth as we're starting to kind of get more comfortable with having the youth advisory board, thinking more broadly about the professional speakers that we expose them to. So I feel like in this past 2 cohorts, it's been heavily pharmacy and other research-focused career paths. So kind of broadening that up for students that might not be interested in solely pharmacy or research career paths. Creating more opportunities for them to have more first-hand research experience. As I shared in the first year, we kind of didn't want to ask too much from the youth, but we've seen that they really want more hands-on research experience. So we've been trying to do more of that with this year. And just thinking about how to engage more underrepresented minorities in our group and thinking about how to kind of broaden the diversity of our group, of our youth advisory board. Okay, so just some things I wanted to share if anyone were to be interested in building a youth advisory board. Like I said, we have a paper that we've published about this that has a lot of details, but there's just a lot of things to consider. It's definitely a lot of time and effort from a planning resource standpoint. But I just wanted to kind of throw some things out there that are worth thinking about. Like I shared in the beginning, it was really helpful for our group to observe a functional lab, the SMART YAB, and to just understand what their processes were like, figure out what we liked, what we thought might not work well for our purposes. Earlier on, it's good to think about what age group you're thinking about how many youth you can kind of manage. That's realistic. If you want it to be virtual, not virtual, how you recruit, as was brought up earlier on, how often you want to meet. So there's that continuity in interacting with the youth members, where it's also not a burden on them, and thinking about what mentoring would look like, and what kind, if you want youth that have no research experience or some research experience, and how funding and staffing to really be able to implement this on for the long haul. Some of the things we've had to think critically about as we think about maintaining our YAB is really having clear agendas. Again, this is not an exhaustive list, but things I just wanted to share, things we've had to think about. I've seen that it's really important that you're tailoring the meetings to meet the interests of the youth, and also the ultimate purpose for which you have the YAB, and that adolescents can be very invested and more excited if they're also and ready to communicate, and thinking about how to facilitate that and facilitate communication about research. Some of the things that we've seen when we're inviting speakers is that it's really important to kind of think about the scheduling of those speakers with the scheduling of youth. Okay, I see a comment in the chat. I'm going to pause. Sorry, that wasn't a comment. That was Felice posting. Okay, I'll keep going. So some of the things we've struggled with is when we've identified speakers or topics of interest and then it doesn't work, we try to figure out a time when we can get as many youth members together. And then it's kind of late on a Sunday and it doesn't work with the speaker's schedule. So that is typically really hard. And so usually we have a variety of options of speakers and topics, just because we found the youth often don't like scheduling ahead of time. So that can be really, really tricky. The other thing we've had to think about is, depending on if you have rolling recruitment, you might want to kind of invest in how you vet students and appropriate correspondence with them, and in thinking about how to adapt presentations based off of the youth needs and members that you have per time. The other thing to be aware of is just the requirements from a university standpoint. The Office of Youth Protection has lots of good training regularly on and reporting that's necessary with engaging with youth in this capacity, and also training staff that are involved in interacting with the lab. So just something to keep in mind. Overall, I would say for us, it's been, having the YAB has been exciting. It's been a fulfilling experience, even though it requires quite a bit of dedication, creativity, and intentionality, but it's really been a worthwhile experience for myself and members of our lab team. Okay, that is all I have. I am happy to take comments, questions, and thank you so much for joining my presentation today.
Thank you so much, Funmi. This is just really, really excellent work. I have a few questions. First of all, I'm wondering if most of the youth who participate end up, are they, because you're collecting a little bit of information about their prior experiences, do they tend to be folks who are like already highly motivated towards a career in research or pharmacy or medicine, and they're sort of like, you're getting the like straight A students, or is it really a range of sort of backgrounds and experiences?
So honestly, I would say in the first year, it probably felt that way. But I'll say with this, our current cohort, not so much, because I think what's happening is people are telling people, and we've had students that kind of, they don't, at least to us, we don't collect that information, but I feel like we have a mix. with this year's cohort of 16 students, we have students that are kind of gung-ho about research and some that are just trying to figure things out, meet other teens, learn, or they're not necessarily interested in pharmacy. And they tell us that they're pretty blunt. Once they get comfortable with you, they kind of tell you, nah, not what I'm thinking, or I'm just looking to learn. So I think this year we have a better mix, but I would say our biggest challenge is we have mostly female. I think that's kind of a tough one that we're still trying to figure out how to address. Oh, sorry, Dr. Mahoney, I see you have a question.
Yeah, thank you. Oh, this is great. And I have to say that now that my teenagers have left the house, I love hearing about teenagers. They're quite a characters. So I was wondering about, so much of your work is really sort of developed to reach at-risk students and youth. How do you feel like if you were to have the chance to reach at-risk students, that it would be some different voices? And second, how do you think you could reach them?
I love your question, Dr. Mahoney, because I've thought about this a lot. And I actually thought about this even earlier on when we were thinking about the purpose of the YAB and just why we're spending the efforts that we're doing. That is really my goal. But I recognize that in the beginning, we were a fish out of water. And I think I saw someone from Brad is on here. We did not know what we were getting ourselves into with starting a YAB. And Brad's group, through the SMART group, really helped us. And at that point, we felt like we just needed to figure out a structure of how to do this, if we have the capacity and if it turns out to be as fulfilling as we hoped. So now that we're in our second year, our team is comfortable, we're loving it. It's such an important part of what we do. I think we're ready for that. And so one of the things that I think with at-risk youth is it might be challenging virtually. I think we might have to meet them where they are, like either through schools or through youth organizations. And it's hard to build trust. So I think with that piece, in person, honestly, might be better. And that's why with like our Milwaukee patch group, that's why we're kind of going, we're starting to want to do that. But we kind of recognize that an in-person structure might work and it might take longer to build trust. And we might have to think about partnering with community health centers that have established those relationships with those groups. But that's really where I would like to see this go. But in the first year, we were kind of thinking, do we know what we're doing? Can we really pull this off? And then thinking about resources to sustain this over time. But just seeing how valuable it is to the youth, I think more of that needs to happen. But I'm in agreement. That's where I would really like to see it go. I'm not just sure about the virtual option till we develop kind of ongoing relationships to invest with them and show that I think what I've seen with them is we have to show we genuinely are invested in them and invested in developing them and committed to that. I hope that answers your question.
No, it makes total sense. Very good.
I wonder, Funmi, so way back in 2000, I worked as a research assistant on a study where it was a study where we were recruiting sexually active adolescents between 15 and 21. And we ended up doing a lot of recruitment at things like Job Corps, or there was a program called Youth Build. And we would go and give a presentation. And then at the end, we would, give out our cards. But it ended up being like the third or fourth time before people like knew us and engaged. And it was often like somebody there vouching for us that made a big difference. And so I wonder if maybe you could talk a little bit about that, whether or not you're using whether or not those connections are helpful. And also, I wonder if Andy has anything to add in the like education space around sort of best practices for interacting with this particular group.
No, you're spot on, Heidi. And that's kind of what we've done with partnering with Patch. So even before developing the Youth Advisory Board, we had an ongoing relationship with Patch. We actually have brought them into the pharmacy school, have them talk to us, gone out. So we've been doing that for a while. My cousin actually leads one of their groups. So we've had to work hard to build that trust. And we also go and present and share, and that back and forth is there. So I think that's very crucial. And actually, like I was relating to Dr. Mahoney's question, without building that trust and someone vouching for you, I don't think it could be very successful. One of the things we struggled with that you might not have seen is we started during COVID. So in the past, I had been going to a lot of schools across the state for our work. So we have some of those relationships with different schools in different parts of the state. That all kind of during COVID, they were all kind of like, no, and it was just not appropriate. We tried to connect virtually with some, but they were just overwhelmed. And so we recognized we kind of needed to give them some space. But now we're starting to kind of rebuild that and go back out as people are willing and able. But in the past, that's kind of what we did. We were in different schools and presenting. A lot of our students' orgs do medication safety presentations, but a lot of that stopped during COVID. So we're just coming out of that. But I really think that's kind of, that was our hope, and I would really like to see us go back to that as more schools are more open to that.
And do you pay them? Do they get paid for participating?
Not for the Youth Advisory Board. And that's why we do a lot of professional development. If they participate as like piloting, like the research piece, then they get paid. But we've skewed it more towards professional development. Even from this year, I feel like we've spent more time in teaching them about research and helping them think about ideas with public health issues that they're seeing, or medication misuse issues that they're seeing in communities they live. But if they participate in an actual research project or tweaking that, then they get paid, is kind of how we have it structured. Great question.
Andy, do you have any suggestions about how to engage male youth particularly?
I mean, I think I would say that, I'm not sure that there's anything in particular in like the education space that's different than what I would offer from what other folks have shared. I mean, I think that it, in schools, I think like others have shared, comes down to like a trusted person. I mean, sometimes there are like affinity groups or affinity spaces in schools, and sometimes like that, like facilitator or mentor or teacher, who's supporting, one or more of those groups could serve as a collaborator in those efforts as well. But I think it's, I think overall it's pretty similar to what other folks have shared.
Yeah, the other thing that I've wondered about, so pharmacy in general, we always have this issue where we have more females applying. And so sometimes I wondered, are we getting a lot of people that are considering pharmacy, which tend to be female? So I've also wondered about that, but honestly, I don't know. What we've been doing is trying to go out and see how we can get their input through other groups, since that's not well represented with our Youth Advisory Board.
Yeah, this is just like a total aside, but when you were presenting, I have teenagers, niece and nephew, and I immediately thought about like, oh, my nieces would like to do this. And I didn't think at all about my 14-year-old nephew who's like out skateboarding all the time at the skateboard park. But like, it's so, there's some biases, I think, too, probably among the trusted people about who they're sharing it with as well.
That's true. That's very true.
Well, this has been really just an excellent presentation, and I love thinking about teenagers and how to engage them. I have pasted some links in the chat for how you can sign up for future DRISS sessions. Felice pasted in the chat earlier Funmi's paper describing more about this process. The last link in the chat is a feedback survey, and we really encourage you to give us some feedback on these sessions, because we want to make sure that we're continuing to deliver what's useful for folks across campus. So thank you. And I can't believe your kids behaved themselves the whole time. They didn't crash your presentation at all.
Yes, my husband is holding them down in the basement. I'm like, they have an hour to stay there. Do not let them come up. This is being recorded. Thank you all so much for the time to share and learn from.
Thank you so much. Such a pleasure to hear about your work. Have a great weekend, everyone.
Have a good weekend, everybody. Bye. Stay warm.
Thank you.